On December 23rd, the CDC updated their guidelines, shortening the amount of time to quarantine. So there are a set of guidelines for the public and a separate set for healthcare professionals. Now, local healthcare employers are questioning these guidelines while management is supporting them.
In our ICUs, the nurses should have sometimes one patient, sometimes two, depending on the sickness of the patient. And many, almost every day, all of our ICU nurses have 3 patients.
Las Vegas registered nurse and chief nurse representative for National Nurses United, Nicole Taylor, says there's pressure to do more with less staff.
If you're having symptoms and the CDC tells you, as long as your symptoms have improved a little, you could still go back to work.
The CDC's current guidelines for healthcare workers who tested positive for COVID-19 include if and when scenarios. The chart has contingency and crisis levels. Healthcare workers could go back to work after 7 days or after 5 days with or without a negative test if asymptomatic or mildly symptomatic. Under a crisis level, there are no work restrictions.
Nurses have people's lives in their hands. And when you are asked to be mentally on your A game for 12 and a half hours with not the correct amount of staff. You're taking care of more people than is normally considered safe. And if you're still sick on top of that, you're not on your A game.
At Sunrise Hospital and Medical Center, the chief medical officer says the main focus is how to get staff who are healthy enough to provide care to return to work.
I was actually and I won't say happy, but I felt that it was the appropriate decision by the CDC to really look at the data and determine at what point can our employees come back to work, because we need them desperately.
I asked Dr. Murda if the hospital had a plan in place during a surge like this.
We're in the middle of our plan, right? We have record number ER visits. We have done everything we can to limit the number of patients that are coming in.
At a different hospital Nicole Taylor works at, she would at least like to know of a plan.
I can't tell you the number of times that I have heard that the hospital is coming up with a surge plan. We're 2 years into this. This surge plan should have existed a year and a half ago.
And what's being done locally to help, Clark County has submitted a request for additional staffing for hospitals. That request is still pending. Reporting live in Henderson, Lauren Martinez, Fox 5 News Local, Las Vegas.